Okay, Rachel, so great job. So why don't we do a little debrief on that skill that you just did? So tell
Okay.
me a little bit about what you noticed about your patient.
Yes, can I use my notes?
Oh, yes, of
Yes,
course.
okay. Okay, so yes, I was caring for my patient and I noticed that I know he's nonverbal, but I noticed that he was sort of having some pain in this area. Now I know it was his bladder that I think he was really pointing toward.
Yeah.
And I also noticed that there was some tachycardia, that his heart rate was high.
Okay, okay. What was his baseline? What was his heart rate?
Yeah, his baseline was in the 70s, and then just now he had gotten all the way up to about 110 was the highest that I saw.
Okay, so what did you do with this information? How did you interpret this information?
Yeah, so, well, I definitely checked his trends. I looked at his heart rate in the flow sheet, and I noticed that it had increased. I also noticed that there had really been no pain before.
Okay.
I know that he has been back from the OR for about the past 6 hours, but even before he went to the OR, he wasn't reporting any pain. Yeah, that's
Good.
sort of like the data that I took from
Good,
that.
good. And then, so what did you do?
Yeah, so after we looked at all of this together, I think what we realized is that we should bladder scan him because maybe he was retaining urine.
Good.
So I did respond by getting the bladder scanner, and he had 518 milliliters of urine in his bladder. So then we went to the provider and we presented this information in SBAR, and we got an order for the straight cath. Is that what it's called? Straight cath?
Yes, the straight cath, yeah.
And we actually got a little bit more than the bladder scanner. We got about 550 milliliters of urine.
Yes. Yeah, the bladder scanners don't always show exactly the correct information, but
Okay.
Okay, great. And then, so what do you think for the future? Like, what do you think about what happened?
Yeah, so I think in the future, when I come in, before I'm going to assess my patient and then really look at the flow sheet and the trends, really trend and see, what was he taking in, what was his output, what was normal for him, and then what are those normal vital signs. So that way, if I sort of like see these things happening, then I sort of have some more clues to help me figure out what's going on.
Good, exactly, perfect. Okay, great. So this is a good time now. Why don't you break for lunch?
Okay.
And then make sure that you prepare for the debrief during our post-conference. We'll talk about it a little bit more then.
Okay.
And we'll discuss it a little bit further, okay?
Okay, perfect.
Great job again.
Thank you so much.
Okay, enjoy your lunch.
Thank you.
You're welcome.